Dr. Amitabh, wonderful seeing you here. I always say you're sometimes controversial. I will not repeat that.
I will expect the fast bowling and again. Every time I'm facing the same bowler.
No. But I will say that your comments are as sharp and incisive as a surgeon's knife. So that remains there. So I will ask you a question for what was left off from what Kishore asked about doctors being gods. That was a concept which was there in the 80s, which where people who didn't have access to medicine and didn't have access to gods finally had access to doctors. So that was the first line of the god that they met, and they had this god in front of them. But now, and it was also used for covering up some of the controversies, like the medical college issue, the Consumer Protection Act, the kidney issue. All these things were used, and then you had a lot of films saying that this is Bhagavan in white coat. But then what happened now is that this family doctor is all gone, and then you have commercial establishments coming. So the general concept now is that if you go to a doctor, you will not only lose your patients, but also lose your money. And so there is a general concept that some of the institutions, I would not say all, some of the institutions are actually exploiting the patients. So what's your view?
Thank you, Mr. Shankar, and I should thank Mr. Kishore for asking that question. I was so excited. Coincidentally, I was just reading that feature. I mean, it's telepathic.
Yes, yes.
Paper is out. I have got the answer here. So
yes.
Things allowed in this session.
It is by Kiran Kumar.
So this is research done by, actually what it just struck me about 30 years back in time. I'll just, very interesting anecdote. Actually what I have experienced over the years, as I think Dr. Rajesh also got quite worked up when he was asked that whether doctors are gods and there is a alternative view. What I think, there are cultural barriers. Among the urban, among the educated, among the medical college, we move in a particular cultural environment, and we think and we do our best. There is no doubt that doctors work 24/7, they put their life at risk. But across the cultural barrier, this is not conveyed to 70% of our people coming from different regions, particularly the rural areas. They have got a different ear, and when they come to the doctor, sometimes the doctor is very busy. I had brought out by Dr. Mohit also that they do not have time to educate the patients, where the role of the family doctor comes. And that is a species which is gradually disappearing because everybody is going for specialization. So we require to improve the institution of the family doctor. We have to think. And in fact, I was just a plain MBBS 30-40 years back when I had joined the army as a young doctor. And that time we used to practice as a family doctor only, 3-4 years. And I thought I am communicating very well to my patients, which were the troops. We had a OPD. As a general duty medical officer, I used to run my OPD in the morning. I had an office as a separate OPD away about 2 kilometers from the military hospital. And I was a young doctor, and I used to finish my OPD very fast and go to the military hospital to practice anesthesia and other things which I was interested in, the OT and holding the knife, as you said. So I used to think that is the actual technological medicine. So I used to hurry up my OPD and go to the hospital. That was 34, somewhere in the northeast in Nagaland. So one day I was walking in the evening. In the evening, I saw a long queue, and I was seeing that I am treating my patients very well. In the OPD, I used to prescribe the correct medicine, give them whatever, and hand it over to my nursing assistant, medical assistant. So one day, and it was a South Indian Madras regiment. So there was a language barrier also. So I used to talk in English, Hindi, they never used to understand. They used to talk something I never used to understand. But I used to think I am doing the correct practice. I thought I am God to them. So one day evening, I was taking an evening walk, and suddenly I see a long queue in front of my office. I was in civil dress, nobody recognized me, so I walked up to the back of the queue. I said, "What's happening here?" He says, "The doctor is inside, he is seeing patients in the evening." I said, "Okay, but the doctor comes in the morning." He says, no, the one who comes in the morning is no good. The evening one is very good. I was this was curiosity. I was surprised कि यार evening में कोई बड़ा super specialist आया होगा. So I just peeped to the window and peeped in. And I saw my nursing assistant, he is explaining in the language. He was from South India. He was taking my prescription in the morning, and he was explaining to the patients about lifestyle, about rest, about food and exercise, all those things. Then I realized that even MBBS knowledge is too much. I think is not enough to communicate to people from a different cultural background. So that was an eye-opener to me. That is what we are lacking in the present day medical education, because we are going too much science and mechanical models. So doctors think they are doing their best, but a little software adjustment is required. I mean, there is no interface between the software of the patient who is coming from a different cultural background and the doctor who is highly trained. So this some little tweaking is required, so that there is an interface. The doctor particularly trained in even in the formative years, something about social medicine, about humanities, and there is a recent change in the medical curriculum. I don't know, with the too many students are there. Like in community medicine, from first year the student has to adopt few families. From first year to family years, go to the community, go to the rural area, adopt some families, and see the environment, see the lifestyle, see, and accordingly counsel the families. So this is very good in theory and concept, but giving the huge syllabus, I think how well it is translated. So these are some of the gaps we have to, as a doctor, I think all specialists, and as a family doctor, we are not having adequate family practice. So the specialist, it's not fair to the specialist also. They don't have time to give this, such good advice can be given to each and every patient. So they could train some social workers or something to give them education. Thank you.
Speaking of communication gap, I have one question to Dr. Mohit Gupta. Dr. Mohit, are you available now? We had asked Dr. Mohit to come online. I think he's slightly busy. But I will now move on to Dr. Rajesh Jain. Dr. Rajesh Jain, welcome to the show.